Hey babies, how y'all doing? This is just a medical rant that I'm having and I wanted to share it with you. I had a doctor's appointment for today and Sunday they called me and told me they needed to reschedule, which I thought was strange as hell, but okay, whatever. So I called the answer machine back and they want to reschedule for next Monday. So I rescheduled, canceled my cab, order another Medicaid cab. Okay. You have the audacity to call me today and tell me, oh, the doctor is too busy at this address, you're going to such and such. No, hold up, wait a minute, you got me twisted. I make the medical decisions in my life. I do. I make the first decision, I make the middle decision, and I make the last decision. I don't care what insurance I got. And I got Medicare and Medicaid. But I make the decisions. Nobody else make no decisions for me. All you can do is give me your medical advice. I will talk to my primary about it, and we will come to a conclusion, and I'll give you my medical answer. But all that other messy stuff that doctor's office like to do and try to pull the stops out at the last minute and try to tell you this and that and this and that and that ain't happening in my life. So I told this man, I said, you called me and approached me in the wrong way. If you'd have called me and said, well, I know you're scheduled for Monday to see the dermatologist and she's quite busy, I'd said, excuse me, hold up, wait a minute. My appointment was for today. And I got a phone call on Sunday saying I had to reschedule, which I did for next Monday. Now you're calling me, telling me I got to go over here. You know what? Cancel the appointment. I'm not going through all this messy shit with you. Cancel the appointment. I make the rules in my life when it comes to medical. If you'd have called me and approached me the right way, maybe I might have went. But for you to tell me what I'm going to do and what I'm not going to do, no. I make those decisions. So, oh, well, I can't talk to you. No, it's not that you can't talk to me. You're talking stupid to me. I run my life. I don't let no program, I don't care how much medical I got wrong with me. I don't care what my medical disabilities is. I don't care how many programs I get into. I don't care what they supposed to aid and help me with. Once you start trying to take over my life and tell me what I'm doing, you're done. You're 100% done. I don't care what your benefit is. I can find another dermatologist. And that's what I told him. No, too messy. I done already scheduled my appointment. I done already changed it once for y'all. And here you come again. No. Too much. I don't do mess. No. Cancel it. I just won't see the doctor, period. You can tell her if you want to. I can tell her if I want to. She do not have to worry about me coming to that location or any other location for her. I will find me another dermatologist. Because see, what people don't know about me and what a lot of people don't know in general, any medication that you get from any other doctor specialist, you can get from your primary. You do not have to keep putting up with that aggravation. Everybody wants to schedule. Everybody want to schedule 10 to 15 people for one appointment because they want to make sure they're getting paid. So this one might be late, this one might not come, or whatever. So they want to keep billing the insurances. And little do you know, they try to bill ahead of time before you even come to that appointment. They want to make sure they're getting paid. So you done tried to get paid and they so busy that you done lost the patient messing with me. Because the last time I went through this with you, I was scheduled for in-office surgery. You tried to tell me I was supposed to be at a whole other location that I ain't know nothing about. Nobody never told me about no other location or nothing else. Because when I talked to the dermatologist, we talked about me seeing you here at 4949 Harlem Road, Western New York Medical PCs. And now y'all coming up with, oh, switch over here and switch over there. No, no. Stop. Ain't gonna happen. I don't do all that. I go to the doctors in the suburbs for a reason. That messy stuff that happened in hospitals and clinics in the hospital, and the messy stuff that go on in the offices in the city of Buffalo, New York. I don't have a mentality for that. I'm not trying to see the Holton Center. It's too cold. So I'm not doing that. Just ain't gonna happen. So here I'm going to another suburban clinic. Loved it out there. Matter of fact, the same place I go to do my medical studies. And the dermatologist left and didn't forewarn us. That's a problem for me too, because I got people issues. So if I come to you and I tell you what I need out of you, I'm going to tell you when I first meet you. If you decide to leave, let me know. Don't let it be I call for you and then you're not there. And that's what happened. That's how I wound up over here at 49 Harlem Road. And I tried everywhere else, but oh well. At that time, I had different insurance. But for you to just up and leave, okay, now you up and left, so the medications you had me on, I had my primary put me on. Get to another dermatology, you was understudying under this doctor, and you put me on something else. I don't care what you put me on as long as it works. If it works, it works. I'm great with that. But don't think I'm going to be running through the tulips, jumping and rolling over to see no doctor. Cause I already have trust issues, and I already have trust issues for a doctor. You got to prove to me that you are a doctor for me. So when you don't prove that you're not a doctor for me, I'm out, because I can get it from my primary. Best to believe, any medicine I need except for pain management, I can get from my doctor. I don't care what the medicine is. I can get it from my doctor. She gonna write that script. And if she don't write that script, the insurance company is gonna write that script. Because the insurance company has a dermatologist, well, not a dermatologist, but they have a pharmacy on staff. So if you're having problems getting medication through any of your doctors, or you're struggling with your drugstore because you done switched insurances and now you're struggling to get medicine, tell the nurse that belongs to the insurance company. They will make it happen. So I just wanted to give you this little bit of information because you might be going through some of the things that I'm going through. I do not let doctors run my life. I am sorry. Doctors are human just like me. They put their pants on just like me. They eat just like me. They do everything just like me. The only difference between me and them is they furthered their education by going to school and doing interns to be a medical doctor, where I didn't. I've went to school 3 different times, now mind you. But I didn't choose to do that. But I am self-educated. You will not do what you want when it comes to me. So I just wanted you all to know what was going on, because you might be going through something like this. You know, doctors and staffs of doctors, they think they run everything. They think they tell you you run. I don't do that at all. I keep a dossier with me, a list of all my medicines, generic name and brand name, a list of all my doctors with addresses, phone numbers, fax numbers, if I got their personal cell phone number, their cell phone number, what they're treating me for, and the medication, and that's it. And I'll give that dossier to every doctor I see, and they can make a copy of it. But to think you gonna run me, no. That don't work for me. And then what make it so bad, most of you doctors are hooked up with Collider Health. I would never let Collider Health doctors operate on me. I don't care who it is. They operated on me one time, and that was a mess. And that was when I was having my kids, so I had to go to Children's Hospital. Okay, fine, no problem. Since then, I've tried Collider Health hospitals here in Buffalo General. Had to deal with children for a minute as I've been older. Even the clinic. Baby, if you do not keep track of you medically and know what's going on with you medically, and you're just going from this doctor and this doctor tell you this, and you go to this doctor and this doctor tell you this, and you go to this doctor and this doctor tell you this doctor tell you need an operation, this doctor tell you need a biopsy. If you need a biopsy, they cutting something off of you and they not giving medication. They ain't gonna work for me. You gotta put me to sleep, because that means you're gonna hurt me. That means I'm gonna hurt you and wind up in Hudson. Ain't gonna happen. So, I have to think about what's going on, what you're saying to me, and understand what you're saying to me, and do what I have to do that's best for me. And I want you to do what's best for you when it comes to medical. I want you to do what's best for you when it comes to everything, but especially medical. Do not let a doctor's facility, office, doctor's testing, or whatever try to tell you what you gotta do. You know what you gotta do for you. And I understand some of y'all need that push, and somebody might need to tell you what you need to do. But if you're unsure, if you go to a doctor and they tell you something and you're unsure, go talk to your primary. Primary is supposed to be your first point of access when it comes to a doctor. They're supposed to keep all your records from every specialist you go to. They're supposed to know what's going on with you. So if you go get a test done, or if you go get a in-office procedure done, or if you go get a surgery because this specialist told you, tell your primary. Next time you see your primary, tell them. I guarantee you, tell them. And if you don't know about getting a primary doctor, get a primary doctor that's also an internal medicine doctor. They're called an internalist. Get one of them for your primary. It's the best doctor you could ever have. Is an internalist. Somebody that studies the whole body on the inside. If they can study the whole body on the inside and know what's going on with you, they can be an excellent primary doctor. Because if you have problems or issues or whatever is going on with you, and you didn't went and talk to your specialist for this, that, and another, when you go in and talk to your primary about it, they're going to understand what you're talking about, because they have that background. And they can, explain your blood tests and what the percentages was and what they saw and what they didn't see. They can explain things, and they can make it easier, so they can take it from a high level scholar talking to you and bringing it down to you like you're a toddler, because that's how I have them break it down to me like I'm an infant. And then you can have an understanding of you and what's going on. And then when your primary gives you your alternatives, or your specialist gives you your alternatives, then you know which way to go medically. Make it your decision. Never let a doctor be the decision maker on your medical. Let it be a decision that both of you made together. We made this. So I just wanted to share a little something with you. But now I'm looking for a dermatologist. I got Fidelis Insurance for Medicare and Medicaid now, and I like it. I liked United Healthcare when I first got with them. But United Healthcare, they only deal with Collider. So you're stuck with going to all Collider doctors. My doctors are specialists, and they're private doctors. So as long as I got a private doctor, I can go wherever I want. I can go to this private doctor, and you can be with Kalida. But when I'm going to get that surgery, I'm going to Catholic Health System. You best believe it. Now, don't get me wrong. They worry the hell out of you in Catholic Health System. I think that's just their job in hospitals, to worry the fuck out of you. They want to come in and, how are you doing? And for a needy person, that's great. I'm not needy, so I don't need that. Come in, get my medicine, take my pressure or whatever you got to do and get the hell away from me. And we be good. I will heal myself, and you will see me walking the halls. When you see me steady trying to walk the halls, whether I had an operation on my leg or whatever, and you see me up, I'm tired of you. And I'm walking the halls because I want my doctor to see, oh, I can function. I need to go home. I can be miserable at home. Misery loves company. I can be miserable at home. And I'm not going to be miserable at home because I'm comfortable. I might be in pain, but I'm comfortable. I can be in my own bed and be comfortable. So, just a warning to the wise. When you are going to these doctors, I don't care if it's something little like dermatology like I was going through, or something big like a heart specialist. You are in control of your health. Yes, they can medically tell you what's going on with you, and ask them. Ask them the informed questions they don't expect to answer. What did you see, or what did you find that brings you to the point of this and diagnosing me with whatever they're trying to diagnose you? Where is the medical evidence? Show me the medical evidence and explain it to me like I'm an infant. And if you can explain it to me and break it down to lowest form where I can understand it without you using all those medical terms and things I don't know nothing about, the words and stuff, maybe I might listen to you. Other than that, I'm going to tell you. And no, I know me. I'm not. I'm going to listen to you, but I'm going to go back to my primary and discuss it with her. And then we're going to discuss it because my primary, she takes out the time. If you need 5 minutes, that's fine. If you need an hour and 5 minutes, that's fine. So, and she's the only doctor that sees you. There's no NPs, which is nurse practitioners. There's no PAs, which is physician's assistants or doctor's assistants. It's the doctor. And that's what I like about going to private clinics. I see one doctor and only one doctor. I do not. Or should I say private offices, because I wouldn't even call it a clinic. She's going to see many patients, but it's private office because it's one doctor, the doctor that you're seeing. It's not, I see you and, oh, I can't see you and now my physician assistant's going to see you and my nurse. No. You should have told me that at first when I first came to see you. If you'd have told me that when I first came to see you, I'd have told you this is not what I'm looking for. This is not what I want. I want a doctor. I want to see the same doctor over and over and over and over and over and over. And if I have to go to the hospital, I want to know that you can practice out of Sisters Hospital or Mercy Hospital or even Kenmore Mercy Hospital. And I want to know that you are the doctor that's going to do the surgery. This one might wheel me down. This one might take my pressure or take my blood. Or even with the anesthesiologist, they might stick me. But I want to see your face right before I close my eyes. I want to know it's you working on me. Not him, not her, not her, not her, not this student, not that student, not this intern, not that. I want to know it's my doctor and only my doctor. If we can't have it that way, I'll let God take care of me because he's been taking care of me all along. Anyhow, this is it for my rant. I just wanted to share because if you don't know, you don't know. So I love you. Toodles.